What's up, you damn hepatic encephalopathy hippies? Welcome to Season 2, Episode 2 of 3 PTs in a Pod. In this week's episode, we are talking about interprofessional communication. We have a couple of listener questions, and we have a new segment that we'll be finishing with today. All right, boys and girls, welcome back. 3 PTs in a Pod coming to you live from the loft, where we live the loft life day in and day out here.
All day, every day.
Third year of PT school. So a little bit, mixing it up a little bit here today in the loft, filming on location. So we'll see how this goes.
Never doing it again.
But yeah, so today we wanted to talk about interprofessional communication. So we hit on that a little bit in our discussion about clinical last week. How do you properly communicate with PTAs, techs, possibly patients, physicians, any kind of interprofessional communication you might have. I think that is something we can talk about. We have Sean in the background opening up his
Can you be
Pop-Tarts.
quiet?
Pop-Tarts. Or something. So let's talk about that. So we touched on it a little bit last week. We said that's something that definitely can be a struggle at times as students, especially, I think. So I think, see if you guys agree, I think it all starts with having the right mindset. In terms of how you approach it. So my thought is, you never know what's going on in the background of the loft.
Alright. Go.
He's dropping like one. Alright, what were you saying?
Alright, so...
Mindset.
Yeah, so mindset.
Mind over matter, yeah.
First off, when you're talking about interprofessional communication, approaching it with the right mindset. So they're part of the...
Delete that.
Yeah, we'll cut this out.
No edits.
No edits.
This is live.
Fucking edit.
Do it.
I don't know how.
Sorry.
Keep it rolling, Captain.
Was there a question? I don't know. Did you ask me something?
Well, okay, so how do you guys approach interprofessional communication, or how have you so far to this point with PTAs and techs and all that kind of stuff?
At my first clinic, there was a PTA. We were kind of just boys. We just bullshitted every day. I didn't actually get to give him anything to do. Like, I guess they didn't really have like students do that. They just like my CI or other CI or other PTs would like give him something, like give him patience or whatever. But I didn't actually get to do any of that. At my latest clinical, there were no PTAs, but there were physicians that I talked to. So that was pretty interesting. So since it was an urgent care, employees would come in. They would like go like to the physician first, and then if the physician deemed that they were like a candidate for physical therapy, they would come to us. But then every week they would go back to see the physician. So I'd have to write up progress notes, like on paper, and give it to the physician for them to read immediately as they get into the appointment. So that was kind of like a direct communication between her and I. And sometimes, like if there was a confusion between how the patient was progressing, or like I had a question for her of what she was going to do, or a suggestion where I feel like the patient needs imaging, or I feel like they're possibly even like faking or like exaggerating their symptoms, like that's something I could go speak to her about and kind of get her opinion, and she would be like, yeah, I agree, or like maybe like it's just like a psychosocial thing. Like they're not necessarily like faking.
So you would have one-on-one like FaceTime with the physician?
Yeah,
as
not
well.
a ton, but like especially like I remember one eval where the mechanism of injury was really confusing because the guy said he was just walking and he like tore his calf. So I wasn't clear on what he was
This is
telling me.
not a duck I've seen before.
I wasn't really clear on what he was telling me, so I went over and talked to the physician because she saw him before me, and she kind of had the same thing. She's like, yeah, I'm not really sure what's going on with that. Ended up being that his insurance, or like the employer's insurance, denied his claim because they thought it was, they thought he got hurt like somewhere before work, and then came into work and reported
Classic
that.
workman's comp.
Yeah,
Gotcha.
But yeah, that was like I had a direct communication, and then she would come in sometimes and ask like, what do you think we should do with this patient? Like, are they good to go, or like, do you think they need a few more weeks? So they were actually like really receptive to it. So that was
Good.
cool.
Yeah. How about you, KP?
My first clinical, again, there were PTAs there, but we didn't really. I mean, I didn't, but I think that was more so because I wasn't really doing as much as I could this time around. But one thing that was cool was, so when they came in for their evals, part of their paperwork was like how many times they want to be seen a week for how many visits, and then who could see them. So there was actually like a sheet that said like the therapist would judge whether a PTA would be able to see them for daily treatments, or if they were like mostly manual, mostly high complexity, the PTs would just take them. So I thought that was interesting because it was a busy clinic. So they would hand that sheet into the front desk to get them scheduled. So it was just like being able to discern whether the patient would be able to be seen by a PTA or just PT. So that was my first real experience. And then the second clinical, there were like 4 or 5 PTAs at a time and like 3 or 4 techs, like I said last week. So a lot different and a lot more opportunity to work with them. Unfortunately, in the beginning, it was more so me doing their work rather than them like me asking them to do something for me, because I was like the student. I was the only student there. So anytime a patient needed manual work or anything, like even techs would work on patients and they needed me to turn on like stim or like place the stim pads. So I was doing that for like the first 3 weeks, I'd say. But it was cool to sort of feel like get that feedback from them. And my CI was just like, yeah, just take as many patients as you can, which was kind of annoying because I had my own patients to work with, and then I wasn't able to see them all the way through because I would have to go see the PTA's patient and do like 10 minutes of manual. So it was kind of frustrating at first, and then, but I mean, I got better at manual because of that. So it's like we said, you're getting better at something along the line. And then by the end of it, I was able to, I worked with the patients. If I knew I had a busy schedule that day, I would work with them manually first, just because I knew I'd have to get the next patient in and work on them. So not so much PTAs unless they were free, but techs definitely. Mm-hmm. I would do all the manual stuff at first, get them on the table, get them off the table, say, hey, tech, can you help me run through their exercise program and let me know if they have any questions. I'll be watching too. I just got to go type something up.
Right.
So that was almost like a necessary thing because we were so busy and I was seeing so many different patients back to back to back that you needed to talk to the techs. But they were awesome about it. But again, it was getting over that mental hump, just like being able to tell someone who's your age or maybe even older to go ask them to do something while you're there as a student supposed to be learning. It's sort of hard to learn how to do that, and I talked to my CI about that. He's like, yeah, I know, it's hard for me too, it's hard for everybody. Mm-hmm. But trust me, they're here to help you, and I'm here to help you, and treat me like a tech too, so he was cool about it. Mm-hmm. But yeah, it still felt awkward until like the last couple weeks where it was more of a necessary thing in order to be able to see all the patients in one day. So.
Right. Yeah, and I think kind of you both have touched on points that go back to kind of my original thought on like just at the first step. So it's definitely difficult as a student and somewhat overwhelming to like take on that responsibility of like management or leadership amongst that like team of people in the office. But I think again, number one is that mindset that you approach it with. So like you guys were saying, understanding that they're a part of the team that is going to come together to give that patient the best experience possible. Number two, like understanding in your head that they also are there to do a specific job, and allow them to do their job, because that's gonna make them more like feel like they're more a part of the process. And then I thought number 3 was, especially towards the like age factor and maybe experience level as us as students walking into a clinic, like no matter what, at that point you're in a leadership role, you know, just because of your position as like physical therapist. So the same leadership principles apply no matter what. Like you can walk into a job and there could be a 25-year-old managing, you know, the clinic, you know, so it's the same principles of leadership apply, and people will respect you if you go in and lead and do your job, and then also, you know, allow them to do their jobs and take ownership and leadership of their roles as well. So
Teddy Y walked in and became manager.
Exactly. And again,
shout out to Teddy Y.
And Jocko Willing's book, like Extreme Ownership, he lays out a lot of good leadership principles that I think, again, no matter your age, experience level, if you are in a position of leadership, there are certain like basic principles that'll make you successful at that, no matter what. And I think that's a good resource and place to start. And I guess, so what about with techs? I mean, I know KP, you said you kind of gave your thoughts on that. Artem, did you guys have techs?
I haven't had experience with techs. I mean, like KP said, my CI kind of by the end just said, treat me as a tech or like an assistant. Like if you need help, just tell me to, you know, go help that patient or like do something. But that was like the most I've had with that experience.
Yeah, and I would say, I mean, for me, we only had usually one tech there at a time this past summer. And it was a 6-week full-time clinical. It probably wasn't until really like week 5 that I was comfortable with just like, you're so wrapped up into like being efficient and effective at what you're doing, to then think about like, how do I manage,
throws you like off your groove.
Exactly. So it's a skill like anything else. It takes time.
You like also don't want to like give up your patience, you know, with that idea.
Yeah.
It's like a weird thought, but you want to feel like you can handle all that you're given. It's a like total ego thing, but it is what it is, and you have to like learn to let go of that, and you know,
for sure,
learn to give up your patience.
It goes back to that. I mean, it's what's most efficient and effective for the patient,
right?
And what's and if you're wrapped up in you know, cleaning 3 tables that were just used and like going in and printing out exercise and all this stuff, you're becoming less effective to that patient for what they need from you. So again, like everyone has their role, respect their role, do your job, and it all comes together to give the patient the best experience, I think.
I use text a lot to figure out what other therapists meant by exercises. Like they would have their own language that I hadn't seen before.
Right, abbreviations and stuff.
And they had been there for like 7+ years, and they know all the exercises just from doing them all the time. Right. So it's just like different, you know, names for the same exercise, but it's like, what is this? What do they mean by that? Rather than bothering another therapist or PTA, they were helpful for that. Yeah,
that's a great point. And again, that has like that buy-in effect of them, like they understand, like if you're coming to them for help and asking for help, they're much more likely to not look at you as being this like, who's this guy just walking in and like bossing me around. They feel like you're just, you know, part of the team as well.
That starts out with the mindset. You were saying
exactly. And then I think another thing, which I think KP touched on a little bit already, but especially as students, like just knowing what they can and can't do as well is a big part of being a student and having like control over that relationship. You have to know that going in, and if you don't, you have to ask someone. Like, especially if you're going to a clinical in another state, you don't know like the rules and regulations. You have to be like, that's the number one thing right away, to know like what each person can and can't do, so that you can then effectively kind of delegate different tasks. So that's a big
I couldn't think of the word. This whole one said delegate.
Delegate, And that goes, so techs, I mean, obviously they can and can't do certain things, and that changes state to state via like, eSTIM setups and machines, and but also PTAs, they can see certain insurances, can't see other insurances, can do certain techniques in some places, can't do them in others. Obviously can't do like evals, so just knowing that's another point as well. What about like front desk employees or anything? Did you guys have any experiences?
Yeah, I mean, when I would do evals, I would have to talk with them about getting them scheduled, who to see again, sort of like the same thing I talked about my first time, whether they should be seeing the same PT, sort of look at their schedule if they're getting re-evaled the next day, try to get them on our schedule rather than like a PTA schedule. Because I'm pretty sure that's the thing. PTAs can take all the measurements and everything, but they can't write up an official re-eval. Mm-hmm. So they would have to have it like co-signed with the PT. So the therapist would have to review all the information, type it back all in, and then, change all the goals and, whether they're making progress and whatnot. So it's not like they can't see a re-eval, it just takes more time because then they have to ship it off to the PT. So is that getting them, two or three times a week, we'll do it this way, and then they're going to talk to their insurance and blah, blah, blah. A lot of like the background like work that you don't really think about as a PT, but then once you have to do it, it's like, oh, I guess that is pretty important.
Yeah.
And the front desk is awesome. They know a lot too.
Absolutely.
About insurances, especially because
I
I know jack shit about insurances and like what is accepted what, and I mean, I learned a lot.
Figure it out.
Yeah.
Okay.
Send it up there.
Yeah, for sure. How about you?
I had a similar experience my first clinical where the front desk handled the insurance stuff and like the paperwork and getting the patient scheduled. Sometimes we would schedule them, or like they would go up to the front desk and do that. This past one, the front desk, they would check people in, and like I would go, if they forget to check someone in, like I would have to go over, like, just because if they're not checked, then they're not in our system, so I can't pull up their note. So I have to remind them of that. They also did like work evals, like, what I'm talking about, where
work conditioning.
But it's like the work conditioning tasks, like before they get hired, they would go over, get their like drug screen, and then do their tests. So like the front desk people would do that. They were technically all nurses, so they would run that. And if they had a question or something like that, if they needed help, like I would communicate with them then. Yeah. But otherwise, they kind of stay.
They were pretty good at it when I was at Novacare, right?
Concentric.
Yeah, I was there once for my part-time and they did a lot of it.
Yeah. So, I mean, I think the basic premise goes for like all of this communication, properly communicate, number one, be respectful of what they do, work with them, where you can help them out with something and make their job a little bit easier, kind of go out of your way to do that where you can and when you have time, basic communication principles. I think another thing too that I had written down with PTAs was just like sort of what you said in terms of text, like where you can find opportunities to ask them questions and make them feel a part of the process. Same with like PTAs, if they've seen a patient for a while and all of a sudden you're seeing them for the first time, like have that dialogue of like, hey, what's the approach here? What have you been doing with them? What's the goal with this patient? And then on the flip side of that, if you're handing a patient off to them, like be respectful of what they can do. Like at the same time, they aren't a tech. They can, not that techs can't think for themselves, but in terms of like their license, like they're, free thinking clinicians as well. So like don't give them like, I want you to do like these 10 things this way. Like, hey, this is the overall goal for this patient. Like, and trust them to be able to execute that goal, as best as they see fit. If they have a question about it, they'll definitely come to you, I'm sure, but don't be like micromanaging the session and dictating to them what they need to do.
It's developing their plan of care, but keeping it like ambiguous enough for them to use their set of skills too. And
for sure,
that's the thing about re-evals and evals. You develop the plan of care, but it's up to the treating therapist, which might be a PTA, to actually implement, exercises to work on increasing aerobic capacity or something general like that. Another thing I wanted to add was direct access, at least in Pennsylvania. So the therapist that has their direct access license can see anyone directly, obviously. But then after that, I'm pretty sure that the patient has to either be seen by that PT or any PTA. It can't be seen by a non-direct access PT. And I don't understand why or how, but that's what I learned over the summer, at least in PA, or at least that might be just where I was, that might be their rule, but I don't know why. It doesn't really make any sense, but
Yeah.
I guess to like keep other PTs, taking the evals, but that's my only, I don't really know.
Well, and it goes back to the point of like knowing the rules
Yeah.
and regulations of
Yeah.
where you are. And asking
Which comes with
questions.
experience. You're not expected to know that, like, going in.
Exactly.
PTAs also fill you in on what they can and can't
Yeah.
do. Try to
Yeah, right.
Give them something and they'll tell you.
Yeah, hopefully.
Text, they should know.
Yeah, exactly. Everyone at the kind of facility should know what their role is and if they've been there for a while.
Even like gait training, you have a gait belt on somebody, the techs weren't allowed to help guard
Huh.
the
Really?
patient with you at my place, yeah. It
See,
had
at
to be a
hospitals,
PTA.
PTAs can do a lot. They just can't do the evals, but they can do-
PTAs could, the techs could.
Oh, I'm sorry.
Yes.
Yeah.
That makes sense.
Yeah. So knowing that stuff and remembering it after they tell you, like, don't keep messing up. If you do something and you weren't, like, that person wasn't supposed to be doing that, don't make that same mistake 3 more times. So yeah, for sure. Any other points you guys want to make to wrap up that
I
discussion?
think that was pretty comprehensive.
Killed
Yeah,
it.
I think so.
Hammered it.
So a couple listener questions I chose out of the thousands upon thousands that
Keep
come
'em
through.
coming.
via
Find the time to
email.
read all those.
Yeah, I mean, just putting in
Grinding.
that grind for the listeners, just trying our best to hear you guys out and answer some of these questions live on air. So
We should get a burner phone for calls coming in.
we could get a live track
Live on
phone. All right, so
Who's this one from?
this one is from Tommy Tech 69420 on Twitter. I just got into PT school. I just got into PT school, bros. What are 2 or 3 of the best ways to make the most out of the last couple months at my job before PT school starts? So I thought that one kind of worked well with this episode because we were talking about,
So
techs.
wait, it's specific to his job, like what he should.
Well, as like he's a tech at his
tech.
job for a couple more months, like what can he do
Yeah.
there, like at the job to kind of help with PT school?
Yeah, get active in your learning. Like go observe evals, ask the PT what he's doing, like have him explain. Like it might take more time out of his day, but like if he's nice enough or she or he is nice enough, they'll sit and explain to you exactly what they're doing. And then if you still have questions about something, start researching that, start reading. Honestly, if I were to tell him anything, I would tell him to chill out before he starts
Yeah.
PT school.
That's a good
You'll
point.
learn a lot when you start.
Yeah, that's true.
Yeah, ask a lot of why questions, be annoying. You've seen all the exercises, you've given patients exercises, don't worry about that, that'll come back
Well,
naturally.
understand why they're being
Understand why,
prescribed
yes,
to the
exactly.
patient.
So it's not what anymore, it's why are you doing that, why would you do that, what would you expect to see like down the line with this patient, when would you start doing this versus that?
Yeah.
Why would you, work open chain versus closed chain? What does that even mean, open chain,
Yeah.
closed chain?
Take good notes and
Yeah.
all that stuff.
And ask the PTs for feedback on school too. What made you successful? What should I be thinking about? Especially if there's PTs that you work with that are like not that far removed from school, or maybe if there's students at the clinic doing a rotation, ask them. What was helpful? What should I think about? What can I do to be best prepared starting out? All those types of things. And I guess too, if there's any other not necessarily that you would go to a continuing ed class, but let's say the clinic itself is like hosting something or is like going to do an event with like runners or working with a team, like ask if you can be a part of that,
Absolutely.
Volunteer your time and try to see as much as you possibly can.
Yeah.
So, I think
Good
that
question.
about wraps up.
What's his name again? Tommy Tech.
Tommy Tech 69420.
Nice.
Second question today comes from Laura in
What's up?
San Diego.
What's up?
Hey boys, huge fan of the show.
Hey, boys.
You guys are all very good looking and
Well, that's true.
very smart, and I'm just such a fan of 3 PTs in a pod. Thanks, Laura.
Do you have a number on that?
No.
There's an email.
Yeah.
We'll DM.
I am a first-year PT student. What are your thoughts on residencies for specialty certifications after school?
Not yet, honey.
Yeah, it's a tough question. I mean, I don't know. I've thought about it. I don't know if it's worth it to me
I agree.
to not make much money for another year to get a board certification. That I think the value in it is like the studying that comes along with it, like the learning you'll do like during the residency. But if you could find like a really good mentor and like work with them or spend a lot of time with them while you're making, a full paycheck, I'd probably rather do that because, once you get your board certification or like board specialty, you can promote it all you want. I don't think a lot of people care. Like they care about your results, not like the letters behind your name.
Agreed.
So,
Yeah, I think it's early too. First year, you said. You may think you know what you want to do.
Oh, but you have no idea.
You don't, honey. You don't. I went in thinking, orthopedics, and now I'm a wound care guy. So,
Yeah. It happens.
I'm treating burns just as much as I'm giving them out. I mean, maybe like second year, start thinking about it if you like are totally, don't even want to think about doing anything else and you want to just gain as much experience as you can in one field. But otherwise, I don't see a real point in it. Why not just gain as much knowledge as you can through the PT program and then use it in the clinic that you're at, and then you'll just develop the same skills there anyway while getting paid for it. You may not just only see that, but you'll learn mostly what you're doing and then a little bit of other things because you treat the patient. It's not just their shoulder, it's their, all their systems together and working together and hit like past medical history. But I mean, yeah, that's how I feel about it. Not for me.
Yeah, I agree. I think we're 0 for 3 on specialty certifications.
Don't ask questions.
I think some of it too depends on like just where you are in life. Like for me, I'm like 45, so I can't really afford to be
6'3".
you gotta work.
I can't really
Get a
afford to
fucking job.
be doing that. So I think like where you are, just in life too matters. Like if you're getting done school at 24, 25, you might have some extra time, or maybe later in life too. I don't know, but I just feel like for me, I'm ready to start, making a full paycheck like Artem was saying, and the give and take from what you get out of the specialty certification versus just working and getting experience treating patients every day and being able to learn on your own what you want to learn, I don't know, is enough to push me towards a specialty certification. Although I do think the only case that I've heard that I would agree with is like, shout out Mike Reinold. Part of what he's said in the past is I think when he first got out of PT school, he did a residency with Dr. James Andrews down in Alabama, who's obviously one of the top orthopedic surgeons in the country. If an opportunity like that presents itself, and doing that residency is going to do more than just give you a couple of letters behind your name, like it's run by someone who's at the top of the food chain.
Someone who you really feel like you would learn a lot from and they would benefit your career.
Yeah.
And you can't get access to them otherwise, then I guess it makes sense.
Plus you could always get certifications in like strength and conditioning, OCS.
Yeah, you
like
can get your board specialty without doing the residency.
Without residency, And even down the line, like make some money, like make sure you know what you want to do, study for that, and while you're treating, you're studying, and then focus on studying like a couple of years down the line, and then you can see whether you still want to do it.
Yeah.
But that's my plan. I mean, I'm thinking about doing OCS.
Ah, sick, dude.
Nice, dude.
I fucking treat patients.
And I do, and know what you're getting into, like research it while you're still in school and see if it's really what you want to do, because I think like the sports specialty certification, you have to be an ATC.
Or ATC, or have like a EMT license or whatever.
So before you start making grand plans,
And talk to somebody, if you can find somebody that's done it, that's been through like that residency, and talk to them, see what their opinion is.
For sure. Yep. All right, so we've got one new segment we're gonna finish with today. So Tom, I'm gonna read a little excerpt. I'm gonna do a little acting here and see if you guys can tell me what this is.
Is it Tommy text?
I don't know what to say really. 3 minutes to the biggest battle of our professional lives all comes down to today. Either we heal as a team, or we are gonna crumble. Inch by inch, play by play, till we're finished. We're in one hell of a fight right now, gentlemen. Believe me, and we can stay here, and we can get the shit kicked out of us, or we can fight our way back into the light. We can climb out of hell, 1 inch at a time.
Powerful.
Why do I know that? You make that up?
That is Al Pacino's Inch by Inch speech from Any Given Sunday.
Oh wow.
So
never saw it.
our sports stuff. It's a football thing.
Fuck is football?
So our new segment, it's going to be called Inch by Inch, because every single day.
Talking about dicks.
I could use another inch.
Inch by inch by inch.
It just ends there for me. Inch by inch.
Just inch.
That's it.
Just inch. God damn.
Inch by inch. So every single day, you should be doing something to become a better physical therapist. So inch by inch, you make your way there. Do something every day. So we're going to share one thing we did today, or within the past maybe 2 or 3 days, to make us a better therapist. No matter how small or big, but you should always be doing something to get yourself further along those lines. So, Artem, would you like to start?
I've been hungover for the last 3 days. I haven't done much, but
I've just been wrestling, dude.
this is wrestling. I did read a article, I think last Thursday or Friday, about the mechanisms of manual therapy in the treatment of musculoskeletal pain, a comprehensive model by Joel Bielowski. We actually covered one of his articles, the sheep in wolf's clothing, about how manual therapy is a placebo. This is kind of
This should be good.
This is kind of just like a more extensive version of that, where they do a literature review covering all the different mechanisms of manual therapy, most of which are not mechanical, like you're not actually moving bones, but it's a lot of giving the nervous system inputs, and the nervous system gives you an output, which is relaxation of the soft tissue or the capsule, and also placebo, which also encompasses the neurophysiological effects, the psychological effects, the psychosocial effects. So kind of on that front, just trying to get a better understanding for what we're actually doing with these patients.
That's sick, dude. I'm only on
What'd you read, dude?
an 8-question streak on PT365, so that's no big deal though.
Okay.
Yeah, I've been hungover too.
Guess all 3 of us. We are 3 for 3 on that. 0 for 3 on specialty certifications. 3 for 3 on.
You gotta be batting 1,000 at something. So I have a nephew. He's 9 months old, and I've been trying to track him along the reflex pathway that we learned first year.
Nice.
Sort of guess where he is at in the stage, whether he's behind, and he's of course flourishing in all aspects.
Of course. Yep.
He's an absolute
Good
stud.
genetics.
Great.
Good bloodlines.
Yeah. We trace back to owning land and running kingdoms. So.
Genghis Khan.
Yeah. But I saw a post. I forget who posted it now that you say it, but I tried finding it, but I can't. So is this? I guess the therapist that I follow on Instagram, his baby crawling with a toy in his left hand. He thinks he's right-handed because he does a lot with his right hand. When he was holding it with his left hand, he would use mostly like an awkward crawl. So he'd flex the right hip only and keep the left leg sort of like dragging behind, and it just looks awful, not real crawling. And then once he switched the toy into the right hand, he had perfect crawling form. So he called it not compensation, but a modification of something. I forget the word. This is bad, but I thought that was really interesting. For the kid was like 8 or 9 months old as well. And I noticed it with my own nephew that he crawls like that when he's holding it in a particular hand, but I'm going to pay more attention now to see which hand. And it's just funny that something that simple, like holding a toy and the dominant or the less dominant part of your brain can, alter things down the chain. And we always talk about like things down the chain, up the chain, and something that simple, like down the lifespan, can alter something like that. And I mean, there's limited research. It was literally just him filming his kid, but I saw it with my nephew, so I'm just going to be interested to see that. Plus, it'll help me study for the boards in the next 7 months?
Yeah.
No.
Something like that.
9 months.
But I think that's a good point. Like, even without even thinking about it, you're like, well, I've been doing PT 365.
Yeah.
Like, I'm just through Instagram. Like, if you're following the right people, when you're just scrolling through that day to day, you're like learning something. So that's the kind of things we're talking about. So mine is sort of along those lines. Post on Instagram by Rehab Science. I really like his account. It's on plantar fasciopathy, the one in particular that I was just looking at. But I like it because he gives you like maybe a 3 to 4 exercise progression about like a particular thing, which is a good quick and it'll give you like sort of a quick paragraph on what it is and a couple of references. So it's just a good like way to, you'll be scrolling through and you saw a patient like a couple of days ago at clinical that had maybe like a hamstring strain, and that's like, it's not the top thing on your mind because you're going through school, you have other things to worry about.
Kind of passive learning.
Yeah, and it's just like, oh, okay, next time I see a hamstring strain, I understand a little bit more about it, and I saw this like cool exercise progression that is backed by some research and I could maybe use, and I've seen videos of like how the movements are executed. So again, just small things like building that into your daily routine of like, even when you're just passing time, make it a little bit more valuable and geared towards something that's making you a better PT. So
cool.
I think that wraps it up for today, boys and girls. So until next time for episode 3 of season 2, we're out.